Hello, my name is Dr. Subendhu Mohanty. I am the Senior Consultant and Head of Cardiology Department at Sharda Care, Healthcity. I'm going to talk a few words and few sentences about heart attack today for the common person to understand what heart attack is and how he can protect himself from this disease. As the name suggests, heart attack is something in which the heart is at risk. There is a sudden event which causes the heart to become weak, and possibly it can lead to cardiac arrest and death of the person also. So what happens exactly in heart attack is the arteries which supply our heart, one of them gets suddenly choked. Now once this artery gets choked or totally blocked, there is no blood supply to that part of the heart. Now when there is no blood supply to that part of heart, there is a risk that the heart may stop suddenly. And if the heart suddenly stops, as we all know, that is something known as a cardiac arrest and the patient does not survive. Common risk factors include high blood pressure, uncontrolled blood sugars, smoking, a poor work-life balance which leads to stress, high cholesterol, family history. Now these are the factors. The problem with heart attack is when it comes to the symptoms, that is the manifestations, they are very similar to what people say as gas, that is a burning sensation or a bloating sensation over the epigastrium, over this area, the lower chest, which people feel that it's just a discomfort, maybe just because of gas or acidity. And most of the time when this happens, it becomes a long process before the person reaches the hospital. Now the symptoms are more or less similar. They can be very close to each other and it may be difficult to differentiate the two. And if without a ECG, it is practically impossible to differentiate the two. Having said that, once the ECG is done, we have to get the next step of treatment. As an initial first aid, if you want, you can take the Disprin tablet, that is the aspirin, which acts as a blood thinner and potentially life-saving. When it comes to the treatment part, as we discussed, it is because of the artery getting blocked. So our idea of treatment is to open that artery. To open that artery, we can give injections, but they don't have a very high success rate. So in present day, we do something known as angioplasty, in which we directly go into the artery and we open the artery. Now both of them, they are potentially life-saving procedures. It is more important that you reach a place which is nearest to your center, which you feel can attend to you as soon as possible. God forbid, if you come to a situation where you feel that you possibly have a heart attack, do not hesitate, do not waste your time by taking antacids and other things. Get an ECG as soon as possible. Preferably go to a place where you know that there is a proper setup and a team of doctors to take care of you. Every minute counts in heart attack and every minute counts for your life. Thank you.